Perimenopausal symptoms can start up to 10 years before menopause. Every woman will have their own way of finding what works for them. For me, reaching out to a naturopathic doctor who did a full panel to check all my levels, very quickly discovered they don't want to share that they've been crying. They don't want to share with their husband that they've been up all night, that they have aches and pains, that they're in a fog for 50% of the day. They're just, let's live it in the best possible state of mind, the best body that we can. Keep your partners close, but let them know that you want them there. For a lot of women, sex is painful during perimenopause, menopause, just because they don't have the lubrication there. Like, I was having literal pain. The symptoms of menopause can last for years. So again, as we're talking about the perimenopause 10 years before, then you get menopause that can last even 10 years.
Welcome, very special guest on the podcast today, and talking about a very important topic for women's health, perimenopause, menopause, and all the things that go into that. A special guest in that you have had your own journey through perimenopause and still going through some of the symptoms. So a very unique perspective in sharing with us today. Just to introduce you a little bit, Tammy Soulier. So welcome to the
Thank you for having
podcast.
Me. It's a pleasure to be here.
You are an RPHT, which, remind me, stands for?
A registered pharmacy technician. So it just basically means I'm a licensed pharmacy technician, registered with the Ontario College of Pharmacists, and I've been practicing for about 36 years.
Okay, perfect. And so one of the reasons I wanted to have you on as a guest on the podcast is really you do have this great and very unique perspective in that you are in the field, in the medical field. So you bring that knowledge and experience as well as your own personal journey. So I think it's this beautiful combination of both. So to start off with, could you share with us a little bit about your journey?
Absolutely. Perimenopausal symptoms can start up to 10 years before menopause. And the estrogen levels that fluctuate during that time are very dramatic. In fact, it's been proven that they're even more dramatic than a girl who's going through puberty.
Oh, wow.
So that I found was an interesting fact to share, because I don't think a lot of people realize the magnitude of the hormonal fluctuation that happens when a woman's suffering through, and it is a suffering through perimenopause. My journey started many, many years ago when I started to have sleep disturbances, bouts of anxiety, bouts of depression, thinking, what's happening to me? And this is going quite a ways back. And at the time when I presented myself to my MD, this is a true story. In fact, he, after listening to my story and looking at my history, his recommendation was to, when you're feeling like that, you should go clean your house. Wow. Exactly. I left in tears and I thought to myself, wow, is this all that we have? As a woman, and just as people in general, we sometimes think that it's okay to accept what somebody like an MD is telling you. In a lot of cases, yes, it's absolutely the right thing to do. But if something doesn't feel right for you, the important thing that you have to realize is it's okay to push back and say, but you know what? I don't feel like that's right for me. And what I will say is that through my journey and through the years with working in pharmacy, I'm very excited to say that things are really changing. Things are changing so much in the world of medicine, of therapy, to help support women who are going through perimenopause and menopause. Compared to years ago, it's really coming to be something that is at the forefront of information for women's groups. And I'm really happy to see that happen. But, being who I am, and maybe other women feel the same way, I followed that sort of pattern that he told me to go through and struggled for quite a few years. And then I started researching further and finding out that this wasn't okay, and accepting that that diagnosis and that way of doing things wasn't going to be okay for me. And it wasn't until I reached out to a naturopathic doctor. Every woman will have their own way of finding what works for them. For me, reaching out to a naturopathic doctor who did a full panel to check all my levels, very quickly discovered that my hormonal levels were completely out of whack, which explained so many things that I was experiencing and going through. And it wasn't until I started treatment that I realized how long I had been suffering for, because the treatment for me worked so well.
Right.
My naturopath set me on a treatment plan that it's not just about hormonal therapy. There are women out there who will not be able to take hormonal. It's not going to work for their conditions, for their history.
Okay.
But there is so much more beyond hormonal therapy. There's supplements, there's exercise, I can just go on and on. The different things that have helped me and that can help other women. And I think it's really important that women understand that, you know what? It's not okay to accept that at this point in your life, you've gone through perhaps raising children, you've gone through marriage, you've gone through your career. Maybe you're still in your career as I am, and you still have a lot of life to live.
Mm-hmm.
It's not okay to say, okay, well, I've had my fun. Now for the rest of my time, I have to be, have frozen shoulder. I have to wake up at 3:00 in the morning and not be able to sleep. I have to have anxiety. I have to have hot flashes. All these symptoms that really are debilitating to women. So for me, it's the journey. What it taught me is that I hope that women can realize that when you're not feeling well, there's more than just one answer when it comes to perimenopause and menopause. And you got to find what's right for you.
Right.
But things are changing. So reach out, look for other avenues that can help you get through it.
Right.
Yeah.
So just not this feeling of resignation, of hopelessness, of powerlessness.
100%.
Because in what you're saying, for the MD, who we would appeal to authority and think that he knows what he's speaking of. And obviously he does in all kinds of ways.
Of course.
But to feel hopeless in that you're feeling this way and the only thing that you can do is clean your house.
Suffer through it.
And really invalidating. And what I hear you saying is really we need to have those conversations. Women need to advocate and really understand that there are different mechanisms of support out there in terms of accessing the information, whether you do naturopathic doctor or MD, what have you. Whether you are a candidate, as you're saying, for hormones or not, as you're sharing. And that sort of the pharmaceutical side is understanding the risks and is it suitable? But also then there are supplements, as you're saying, in terms of like magnesium is a big one, right? In
Magnesium
terms of
with helping with sleep and with muscle, progesterone at night. I read this about some other women, but I actually experienced a patient of mine that said to me that when she started on progesterone for sleep, it saved her marriage.
Oh.
Then what happens there is we touch again on the importance of your partner understanding what you are going through when you are going through perimenopause and menopause. It is a absolute real circumstance. It is a real trauma. And when you have a supportive partner who may need to be educated, just like you yourself may need to be educated, to have that support and them realizing exactly what has actually happened in your body. So very important for your partner to be a part of that, for sure.
And so in the piece around, as you said, because as we see in the mental health piece, is that some people have a sudden onset of anxiety, which never existed prior, or an exacerbation of the anxiety, the brain fog,
Absolutely.
or the insomnia, the depression. What would you say about that, Tammy, in terms of getting the partner involved in that? And what do you think is helpful for the partner to understand? Because as you're saying, as all these changes are happening physically, mentally, emotionally, there's all these things that are happening. And it does impact the relationship because a libido can tank as well. And so there's this piece around if the partner does not quite understand what's happening, they may feel like, oh, it's a rejection, or this person is not attracted to me anymore, or is not interested in me anymore, or all of a sudden our marriage is fine and now it's not. And so what would you say about that piece around really the piece for the partner and understanding and supporting or best supporting?
So statistically speaking, if you were to actually do some research, you will find that it's a very high percentage of marriages that do fall apart during the menopausal phase. 100%. And a lot of it has to do with libido, first of all. Going through menopause, there's a definite tank in your desire for sex. But what increases is your desire for support and understanding. And when your partner can understand that what you give to me with respect to understanding, support, watching the wonderful podcasts that are put out about menopause, watching it with me, understanding, coming to the appointments with me, understanding when the doctor is letting us know from a professional point of view what is actually happening in your spouse or your partner's body, it opens up a whole new window for the partner to understand that, wow, I didn't realize how severe these symptoms are. It really makes a difference. There are a lot of women out there who keep all that private. They don't want to share that they've been crying. They don't want to share with their husband that they've been up all night, that they have aches and pains, that they're in a fog for 50% of the day. They're just completely in a fog. They just want to continue to be that strong woman that's been that woman that he or she has fallen in love with way back when. Communicating, as we all know, in every relationship, I think for women, you have to make it known. You can't stay silent. We're here to live, and we have many more years to live. Let's live it in the best possible state of mind, the best body that we can. Keep your partners close, but let them know that you want them there. So, because the more they understand, the more support you're going to get. And with proper treatment plans, depending on what your symptoms are, things return. Libido returns, energy returns, brain fog disappears. I think sleeping, obviously, in any situation, regardless of going through menopause or not, without sleep, we just can't function. That's when you just can't.
The knock-on effect from so many things, right?
So, one of the biggest things about menopause is the interruption in your sleep pattern. And again, speaking, if I have to say, the one thing that you definitely need to do as a woman, find the right doctor, whether it's a medical doctor, a naturopathic doctor, find somebody that is able to understand and gives you the support that you're looking for. If you're getting just one-word answers, feel comfortable with who you're talking with. Somebody who's going to give you all the information, somebody who's going to know what you want to achieve, follow what your goals are, set you on a treatment plan that's going to guide you the whole way through. And I can honestly say, when I started my treatment, I was literally blown away. Like, I was almost a little bit angry with myself, thinking, why have I waited so long to step up and say, this is not okay? Because I realized the effects that it was having on me once I started the treatment and how much better I felt. If they can hear anything from me, it's don't be quiet.
Advocate. And if you're not getting an answer, try different
100%.
avenues. And you're touching on something that I want to ask you about in terms of professionally, but both personally. And is the piece around, there seems to be this stigmatization sometimes. And I think women almost, there's shame around it almost, I feel a sense of that. And it's isolating with the whole aging piece. Like, women are shameful about aging, about maybe not feeling as womanly as their estrogen is dropping, as they're not fertile. I think there's stuff around that too, where there's messaging and there's social media and all these other things where women, they start to feel less valued. And so I think that there is this element, or some women really, that suffer in silence and don't want to share or feel less than, or feel, as I said, like there's a sort of a stigma, even though you're a woman and you have the estrogen and the uterus and all the parts that that go along with that, is that you're going to go through this regardless if you have children or not. This is a part of life, but yet there just seems to be almost like a shame or a stigma around it. And so I wonder if you could speak to that.
Well, there is, because what ends up happening to you is, as soon as the estrogen stops, first of all, let's talk about your physical appearance. Your hair starts going very thin. The wrinkles are definitely showing a lot more. The weight gain. The weight gain alone, as a woman who perhaps was always fit. And of course, there's women in menopause who are extremely fit, managing your perimenopause and menopause. There's other women who they don't do a lot of exercises.
Yes.
So when their estrogen levels stop, there's a lot of weight gain. So their physical appearance for a woman plays a big part. I used to look so young. Now my hair's so thin, my wrinkles, they're showing more than ever. And that's part of aging. That's all fine. But you have to be comfortable with knowing that, yeah, that's happening to me, but I shouldn't have to feel terrible about that.
It shouldn't define me.
It shouldn't define me. And I shouldn't be feeling sad and depressed on top of all this and not getting any sleep and being in pain. Moving into menopause is absolutely beautiful. Embrace those fine lines. Embrace that little bit of extra weight that you've gained. It's a great part of life, but you need to get there. In my experience, I needed to get there mentally. For me, it was very much like every other woman that's working in the world and even working from home, being a stay-at-home mom. We need to be bright and on top of things. And when you start seeing that you're not as good as you used to be, you're tired, your brain fog is so bad. For me, I did have a lot of brain fog and it came on very suddenly. I literally was like fine. And then over the course of 2 weeks, I started experiencing brain fog like I've never had in my life.
What does that mean for you? Just explain to the listeners.
It literally feels as though everything is just not visually. You can see, obviously.
Yeah.
It's like slow motion almost. It's like things are just going in slow motion. You feel like you're lagging.
Okay.
You're just you're just in everything, like whether you're reading or whether you're at your job or whether you're at home, everything you're doing is just so much effort to get there. And you just feel like you're not clear. And that happened to me. And I'm supposed to be post-menopause right now. Based on my levels, as you know, when a woman's period stops for a year, you're considered to be
in menopause.
The symptoms of menopause can last for years. So again, as we're talking about the perimenopause 10 years before, then you get menopause that can last even 10 years after. It's a huge chunk of your life.
And again, misinformation about that too, because there's misinformation going around there
about that.
You think, it's short and period or not. So
and
not really understanding the duration.
And for some women, obviously the duration is different. I feel like I've been in perimenopause and menopause at least for the last 15 years.
Okay, wow. Okay.
Yeah. It was the brain fog that really threw me over. I just couldn't function properly and I wasn't sleeping, which doesn't help with the brain fog. I reached out to, like I said, to my naturopathic. I didn't have a naturopathic doctor, but I did find one.
Yeah.
That's when we discovered all these things. And one thing that really helps with brain fog is vitamin D. So again, depending on your levels, determines how much vitamin D you should be taking. The two biggest things for me that made a huge difference was vitamin D.
Yes.
Which took probably about 3 to 4 weeks before I saw a change, but I definitely saw a change. And the progesterone. Because it really helped with my sleep. But I was also having a lot of physical pain through my hips, through my abdomen, and the vaginal area. Yeah. And for a lot of women, they describe that type of pain in the vagina as if it's being pulled.
Oh my goodness.
It feels as if something's being pulled.
From your vagina.
From your, like the whole thing
sensation of that
is being pulled. It's such a drawing.
Yeah. And is it a constant sensation, like a constant pain, or it comes and goes?
It comes and goes.
Okay.
But it can come for 3 days and then it'll subside. But again, not knowing what's going on down there. There's vaginal dryness. But for me, I had such pain in my hip, in my pelvic floor, and lack of estrogen.
And so it was the estrogen that helped with that.
For me. Like I said, it's not to say that that's what's for you or for any other woman out there. But for me, I found somebody that listened, understood, gave me options. And for me, those options, life-changing.
And with the estrogen, there's the topical in terms of the vaginal tissue, because the dryness, and I've also learned about there can be atrophy of the labia tissue and just pains and different sensations.
Correct.
So there's the sort of the topical, which isn't the systemic estrogen. And then there's the systemic estrogen, right? Do I have that right?
Correct.
So
Both.
both? Okay.
Both. So it's exactly what you think. The burning sensation from having a lack of estrogen in the vaginal tissue is intense, and vaginal estrogen helps with that immensely.
Okay.
The topical estrogen is, again, applied like to your inner thighs, and it just increases your estrogen levels.
That's the one that's systemic, that goes through your body.
Correct.
The vaginal one
is more local.
It stays localized.
It's local.
Okay.
Correct.
And so the localized, because the piece with in terms of libido and around sex is, I imagine too, that what some women experience is a decrease in lubrication. That's a factor too, right? And then
100%.
and affects, I think, probably gets in their head like, oh, am I not aroused, or am I not excited? And maybe partners also thinking, oh, she's not aroused or not excited. So again, talking about it just to explain this is my body changing.
This is my body changing. It has nothing to do with my desire for you.
Or arousal.
Right?
So because again, I think there's shame around a woman thinking like, oh, wait, like I'm not as aroused, or I'm not as lubricated to engage in sex, and husband or partner is thinking, wait, she's not. There's something wrong.
She's not showing sexually because she's not lubricated. She's not excited to be with me.
Yes, yeah. And so does the vaginal estrogen help with that, or do we still need in terms of like vaginal lubricants? Is that something as an adjunct to that, or not?
Not really. I don't really know that it's vaginal lubricants. I think it's more about every person's an individual.
Yeah.
And depending on the symptoms that you're having will determine from your doctor what's going to not only treat the burning sensation. And for a lot of women, sex is painful during perimenopause, menopause, just because they don't have the lubrication there. Like, I was having literal pain. It had nothing to do, certainly, I shouldn't say that. I'm sure it had something to do with the fact that it wasn't as lubricated, but just in general, also, there was pain.
Yeah.
And when I started using a vaginal estrogen, the result was almost immediate.
Oh, wow. Okay.
Because it's localized. It was soothing. It was,
yeah.
And of course, and then when a woman has that relief, that stigma that she had in her head where, am I not aroused? Am I not, am I not able to do this? My body's not
working for me anymore. I feel, you almost feel, I think as a woman, sometimes you feel let down by your body.
100%.
And then I think also the other thing that's playing in your head, just speaking from an anxiety perspective and mental health piece, is that if I'm anxious and stressed because is this going to hurt, or is this going to, that's your arousal versus non-arousal. You're going to be anxious. Your body's going to be tense. Who's going to enjoy that?
And who's going to climax?
Right.
In a situation like that.
And so then that's a factor too, then, in terms of affecting, if you're someone who experiences orgasm as a woman, is that can affect that as well in 100%. Terms of not reaching orgasm.
100%.
Because I think, and I've read about that as well, in terms of just the nerve receptors change and the tissues changing. And so I think that's another piece that women and partners need to be aware of, is that it can take longer to climax. And then so having support, like what feels good. And sometimes it's renegotiating what feels good and what doesn't, and exploring that together, as you pointed.
Being a part of understanding the changes that are happening to you as a woman, and what now worked before now hurts, or now doesn't quite feel like it used to. Relearning your partner. And I say partner because if there's one thing I've also experienced is for men's health. There's, even for that, it's changed a lot. I work with a pharmacist who is a PharmD, and he does a lot of podcasts for men's health. He has consultations with men who come in to talk about their own problems that they're having, low testosterone, their energy levels, all these things. And, they're afraid. I asked him, what could you tell me is something that when you're having a conversation with some of these people, what's one of the things that you find is stopping them from coming? And he basically just said, they don't want to believe that they have a problem, but they do. And they have to take the barrier down and be able to have the hard conversations, the erectile dysfunction, all of these things.
Yeah.
So I just wanted to say that as we see wonderful things happening for women, there's also support out there for men. And men have to know that you too need to start realizing that it's not okay that you're going through these problems. There's help. There's people that can really, if you find the right person, they can put you on a path that you can live your life the way you're supposed to.
Because I think the same thing for women. I think that's connected to sort of masculinity and what that means for their virility in terms of testosterone and their libido. And maybe if, again, the stigma, but if both parties come together in terms of embracing the changes, as you said, it doesn't have to be, we don't have shame. It doesn't have to be a stigma. It doesn't have to be life ending or life limiting. It's more about, let's have these conversations together and let's advocate for ourselves and explore this together and support one another. Because I think the same thing on the woman's side is that if partners experiencing erectile dysfunction, okay, again, is that me? Is he not attracted to me? And again, if she's going through perimenopause, menopause, she's like, all the things you said, like hair is changing, skin is changing, body's changing. Oh, wait, is this? And it's very easy to personalize it. It's making it safe to have those conversations and being informed, really.
Absolutely. The stigmas that the world has put on things, they're changing. Thankfully, things are changing for women with menopausal symptoms, men with their own problems. The stigma around it is changing. And I think knowledge and being aware that you're not alone, we need to speak up. We need to advocate for ourselves. We need to advocate for our partners and know that it's not like it used to be. When I think about my mother back in the day, going through menopause and hiding, not letting herself express what she was feeling, having moments of anxiety, depression. And I wish that the world could have been at a place where it is now becoming, where there's so much more knowledge that we can express, appreciate, and dive into to help all these symptoms that we're all having.
What would you say in terms of like myths, like top myths out there that kind of you think that kind of you go, oh, you know what? These are like a couple of things that would be helpful in terms of for women out there. Again, sometimes when we go to the doctor or even if we're talking to people, sometimes we get misinformation and then it's perpetuated through social media in all different kinds of places. And so what would you say are some of those myths?
One of the greatest myths out there is that symptoms of menopause don't start until your period stops.
Okay.
Which we've talked about. The perimenopause state is such a crucial part of your body going through so many changes hormonally. That's why I say that don't wait. Know your body and get the help that you need. But yeah, that's one of the myths, that you won't experience any of the symptoms until your period stops. And then once your period stops for a year, you're good to go. That's not the case either. The symptoms persist. Those are the two top myths that we see a lot with menopause and perimenopause. And then there's like, it's just a part of life. You have to go through it. A myth, or maybe that's not a myth, but it's definitely a misconception of what perimenopause and menopause are. The thing that I thought I would share with you is some of the checklist
that would be very helpful
that a woman starts to experience she's going through. So menstrual changes, your periods get shorter or longer cycles, heavier or lighter flow, and then missed periods. The vasomotor symptoms, you have the hot flushes, the night sweats, the sleep issues, your mood and cognitive changes, irritability, depression, brain fog, difficulty concentrating, the vaginal dryness, the discomfort during sex, increased urinary urgency or frequency, big sign for that, breast tenderness, bloating, changes in libido, and hair thinning. We talked about all those things, but I think as we age, sometimes it's just looked upon as a part of aging. But these are, in fact, symptoms that are your body's crying out to you saying, listen, it's time to do something about it.
And I think the more awareness, and as you said, things are changing in the field and people are becoming more aware. People are talking about the same thing with men's health. It's becoming, we're trying to reduce the stigma. But I think in terms of really women advocating and the doctors, the medical field getting more on board in that, I think they're more informed in terms of that awareness that, as you said, like women can have those symptoms or those feelings like as early as like in their 30s.
Correct.
And so they don't have to continue to suffer, which I think by and large, it's changing now, but I think that's been historically the way it's been because they're invalidated, they're gaslit, it's in your head. What else is going on? It's just your stress, or it's just this, or it's really not that. And so when you're sharing your story, I think that's part of that too, where we then start to invalidate ourselves. We diminish, we minimize these things, or we attribute it to something else, or we just think that, you know what, I just need to suck it up. And so I think in getting more knowledge out there and awareness, like the checklist of these things, well, then when we're armed with the knowledge, then we can advocate. And if this doctor isn't willing to do the full panel screen, I saw a naturopathic doctor as well, and they were willing to do a much different screen than at the MD,
that's
right? And so I left that appointment with a naturopathic doctor with a wealth of information about all kinds of things, and recognizing, okay, I actually do need vitamin D, and I actually do need some B12, and some of these things, as you're speaking to, sort of supplements and other things that
exactly, like I said, don't feel that because you are in a situation where hormonal therapy is an absolute no, don't feel like that means that there's not treatment for you. There's wonderful treatment that can still definitely increase the type of life that you're going to live. It's getting to see the right people. And you're right in saying that not all doctors will do a full panel. A lot of those tests aren't even covered, by the regular Ontario drug benefits. They just don't pay. OHIP doesn't pay for some of those tests. But it's important that you do still ask, that you do still say, yeah, but you know what? I would like to know more about my hormone. Can I get that tested and this tested? Having the results from having a full panel is the first step of treatment, because it literally will dictate exactly what levels you're at, what you need, in addition to all the other things that help with menopause, like exercise, supplements, even therapy, women who feel like I need to talk about it. There's all these things but for me, I can only speak as somebody that's gone through it. For me, it was finding the right doctor, finding what treatment would work for me, and realizing that, wow, I've been suffering for a long time after going on the treatment plan, and realizing how much better I did feel. So that's what I really hope that women
understand. Yeah.
And it's not even just about us. It's about even the younger generation that's coming up, daughters and sons, as far as the men's health goes. We have young women that are coming up, and we want them to be even more knowledgeable than we are now, as we are more knowledgeable than, let's say, our mothers. And we're not having to suffer nearly as much as they did, just because we're going out and we're advocating for ourselves. We're saying, hey, there's got to be something else out there. Hopefully with the younger generation, we can teach them that all the different stages of your life, you're going to have certain things that are going to happen, and, reach out and know that there's help.
Okay.
Absolutely. 100%.
What would you say about, so we've talked a little bit about progesterone, and we talked a little bit about estrogen. What about testosterone in terms of women? What do women take that for during perimenopause and menopause?
It's again, without saying what are they taking it for, it's very individualized.
Okay.
It depends on their symptoms, what they're feeling, what their levels are at. Is their body going to respond to the testosterone and get the result that they're looking for? But it's definitely there are definitely compounds that have estradiol, estriol, progesterone, testosterone. These are compounds that are made as a whole that can be done at different pharmacies, compounding pharmacies. And depending, again, on your symptoms and individually what you're experiencing is going to alleviate certain symptoms.
Okay.
For men, they take testosterone when their libido is down or when they are often tired, these types of things. And it does work differently with women, but it's something that is definitely used.
Okay.
I see it in prescriptions all the time.
Okay.
And what I do see is women coming in and just having their world turned in a positive way after starting on some of this. Some of these things.
Okay. You spoke to it a little earlier, but in terms of, and I bring this up because I was at an event, Thriving Through Menopause, and one of the women spoke there, and she's post-menopause and was really feeling like, what is out there for me? And now they've removed the black box warnings, and there's so much has changed.
So important.
And so really feeling, okay, but I've missed the boat, because now we're hearing like all these, taking these hormones really are preventative, actually helpful and supportive. And so again, can you speak to that a little bit for someone who's on the other side,
who missed
that opportunity and maybe feels actually like I felt for her and I felt compassion for her, because it's like feeling like I was guided in a certain direction. And now that really wasn't the best route for me.
Right. Again, treatment plans don't just have hormonal treatments in them, supplementation. And, we talk about the magnesium, we talk about the vitamin D. The fish oil has become a huge part of treating women going through menopause, and all of these different supplements that are available to you, again, depending on what your symptoms are, but help in a tremendous way. I see women in their 60s that have had scares of breast cancer or have had a big family history of breast cancer who will not qualify to go on hormonal therapy. The results that you get from using other supplementation, again, that all gets determined about from when you see somebody that does a full panel on you, knows where you're at. That person will let you know there's all these other supplementations that will definitely help your symptoms.
Okay.
Like we talked about, like the vitamin D with the brain fog, like the magnesium to sleep, and fish oil, and so many other things.
Mm-hmm.
But I think for me, the important thing, like we said, and we talked about, is go out there and find the right person. Find the right person and let them ask you questions. Be open to them. Express everything you need to express. And you'll get put on a path that's going to be life-changing for you.
Okay. Just a couple more questions and then we'll wrap it up. In terms of treatment options, like hormonal and non-hormonal.
Yeah, what we see is, of course, the systemic estrogen therapy, which is available as pills, patches, gels, creams, which are usually really effective for night sweats and that type of thing. And then, of course, we're talking about the vaginal estrogen for the bladder symptoms, even it helps with the bladder symptoms that you get. And then hormone replacement therapy, estrogen and progestin for improves libido, mood, requires individual risk-benefit discussions, right? Simply because, yes, we're not all going to be able to take hormonal therapy. And then there's non-hormonal treatments, prescription SSRIs, serotonin selective reuptake inhibitors, to help with your mood, gabapentin. Gabapentin is a medication that helps with hot flashes and sleep. Oxybutynin, which is for bladder problems, which is a big part of menopause, feeling like you're peeing a little bit. There's medical treatment for that. Reducing caffeine and alcohol. Herbal supplements like black cohosh, they may help with mild symptoms, but evidence is limited with respect to certain supplements and how effective they are. Yeah, so these are different.
I mean, which is great to present to people. And again, so that people don't feel there is something out there for me. If I might not be able to go the HRT route, the hormonal route, there's non-hormonal things out there that I can find support. And really, back to what you're saying, it's really about speaking with someone and having a plan and trying these different things to see if you have any relief from those symptoms.
And there's nutrition, of course, nutrition tips about increasing your protein intake to maintain your muscle mass. Calcium with vitamin D for bone health, omega-3 fatty acids for the brain and the heart health, focus on fiber, whole grains for blood sugar control, and of course, limited processed foods to reduce hot flashes and mood. Sugar is a big one. Sleep strategies that tend to help. A cooler bedroom tends to help just in general, better with sleep, and maintaining a consistent sleep schedule. The regular things that we all know, not having caffeine, not being on the phone, all those wonderful things. And then, of course, for stress and management techniques, there's meditation, yoga, breathing techniques. Actually, I loved to see one of your techniques that you shared in one of your talks that you had about the 2 breaths in and then the 1 breath out. That really works.
I know that works. That's the physio.
Really works. I felt it immediately. So there's different ways. And, this was part of my treatment plan. So this was part of my treatment plan.
Wow. Okay.
So I thought to myself,
this is real in terms of this
was real.
Gives us a sense of how this was tailored to you in terms of
and so it made a huge difference. But if you can take away what's right for you.
Yes. And I think that's fair because as women, we have all the things and we're doing all the things. Sometimes we can be overwhelmed at times. And so I think it's about finding like little tools for your toolkit. Which strategies can I use? And I think the other thing that I really appreciate about you sharing this plan today and sharing this information is that it's connected to agency. And what are the things that I have control over? How can I advocate for myself? So yes, this is a part of my life and I'm going through it. I can't resist it. I need to embrace it. And it's not the ending of who I am as a person, but it's sort of this next version of myself. and defining what that is and what supports you and what those things are. When we have access to information and we have access to resources and tools, we feel more empowered and more like this isn't just happening to me. I can be a part of my wellness. I don't just have to accept this. And what are the things that I can control? Okay, I can manage my sleep better. Okay, I can take these supplements. Okay, maybe I need to get more protein. Okay, yes, I need to add resistance training. Like, what are the things that I
can do when you're not feeling well and you've not been feeling well for a period of time and you finally make that decision to, and I'm just not menopause or perimenopause, just anything in general. And you go to the doctor and the doctor has a solution for you or something to try. You automatically come away from there thinking, okay, well, I'm doing something about it.
Yeah.
You know what I mean? I've made a step to take care of whatever the ailment is you're having, whether you have a fever and you've been sick for days, whether you're realizing that your blood pressure's high. And then you finally say, okay, well, I'm going to go to the doctor. You have the conversation. The doctor tells you things. You walk out of there and you're like, okay, well, you know what? I'm doing something about it. I feel good.
Yeah.
It's no different. It's like you feel so good thinking to yourself, I finally have decided that I'm going to talk to somebody about it. This person's telling me there's hope and these are the things that can definitely help you. You walk out of there and you're like, oh, I feel better already.
Absolutely.
Yeah.
There's studies that show people experience a slight improvement even by making that first call, like to reaching out to the mental health person and making that first call or sending that email or text, what have you. They experience some improvement because there's hope. It feels like I'm accessing support. I'm advocating.
There it is.
Yeah.
There it is. I'm accessing support and I'm advocating for myself. You've decided that it's not okay. It's such an empowering feeling. It really is.
So thank you for all this information that you shared with us today on the podcast. I just wonder if you could give us maybe a few little key takeaways or a few things that kind of stand out for you, whether it's a message or a piece that you want to impart and share with others out there.
Really, it's not okay to feel the way you're feeling when you're going through perimenopause and menopause. It's not okay. It's a real condition. The symptoms are real. It is massive what's happening to your body. And there is help for you if you can just realize that. Don't pass it off. Because I did. I passed it off for the longest time. Oh, I guess I had too much. I shouldn't have had that coffee at 3 o'clock or 4 o'clock. I didn't sleep well last night. Oh, I'm feeling stressed out. You know what? I need to organize my life better. I don't feel very heard and I'm feeling like my husband is not being close to me. But in actual fact, I'm very closed up and he's asking what's going on and I'm passing it off as, oh, I'm just tired. So it's not okay. It is not okay. Women have to start advocating for themselves and know things have changed. The help that has come in the last 5, 6, 7 years, it's really changed and it's only getting better.
Yeah.
As I look at different avenues of help that are out there, I see more and more podcasts, clinics, places that support women. And like I said, for me, it was my naturopathic doctor. And just know that if you don't get the answer that's right for you, there's another answer. Get your full picture. Don't just get the one piece of advice or the one outcome that someone gives you and it doesn't sit well with you, but you think, okay, well, I guess I just have to accept it. No, there's so many different options for you. And it all starts with finding the right doctor. Finding the right doctor, to me, is the key for a woman going through menopause. Somebody that is listening to you, understanding you, and wants you to obviously get the treatment plan that is right for you. Not necessarily what's right for this person or this person, what's right for you. That's really the key. And the other key, like I said, is being open with your partner. Be very open with your partner. Get the support that you need because that's going to help you big time going through it. And don't be afraid. Don't be afraid.
Yeah.
It's life-changing.
When you finally connect to that
When you
support
finally connect
and
to that
access.
support.
And I think the key takeaway that I'm also hearing today, and I hope our listeners are hearing, is that if you don't get those answers and if you don't feel heard, as you're saying, then go on to the next person. Find someone else like that. There is a person out there, a medical professional out there that can meet you where you're at, you'll feel seen and heard, and will help you align with support and a treatment plan that really is, which also is very key. I'm hearing you say is uniquely tailored to you.
It is so tailored.
Yeah.
Like it is, I can't really stress that enough to say how tailored it is specifically to what your body is going through, what your levels are at, what your lifestyle is, what type of work you do that allows you to do certain things. Like it's so tailored. It truly is. You feel like you are getting that personal plan that is literally made for you and nobody else.
Because it's not like you have a headache and here's a Tylenol or here's an Advil, but really what's the source of that, or what, right? Do you really need the Tylenol or Advil?
Or is it something else?
Something that you're deficient in, that you are having these headaches otherwise connected to?
Yeah.
And so, I think the more women that listen and the more women that hear and the more we share and the more we support and the more the medical field and all the other fields support out there for women and for men, as you're saying today, I think
for sure
people will be able to advocate better and be more informed and transition through these different phases of life and more enjoyment and not suffer.
No, I'm able to now embrace. I mean, I'm 56 and I feel so much better than I did when I was 50. So much better than I did when I was 50.
It's a testament, right?
So,
there.
it's there's help.
There's help.
There's help.
And I think that's the thing, right? Is not to feel hopeless or powerless and
know that it's real. Know that it's not okay. It's not okay.
It's not in your head.
No,
it's not, you don't have to accept it.
The brain fog, that's not okay. These feelings that you're having, the dryness, all of these symptoms, all the symptoms that we've talked about.
Yeah. And I think that's a huge thing that I hope our listeners who listen and watch will take away, is that they don't feel alone, and they feel like if even just one person goes, oh my gosh, that's not just in my head, that you feel like, oh wait, it's not just me. It's not just my body. This is actually a part of perimenopause. And there is help out there for me in terms of finding relief and getting support. I think if we could just help one person from that listen to us today.
There's a place in Ottawa. It's called Nutrichem Pharmacy. And for me, that was the saving grace for me. It was a life-changing situation for me, finding the right naturopathic doctor, being put on the right treatment plan. They have naturopathic doctors right there in the pharmacy. And so that was great for me. Find your safe space that is going to be that game-changing, life-changing, literally life-changing.
Because I think at the end of the day, in all this that we're talking about today, it's about quality of life and dignity and how we experience and move through life. And we don't have to suffer. We can move through it with ease and peace, but it's connecting with those supports and those things that are there.
Absolutely. We're not alone. And we have the most wonderful professionals that are there to help us and support us. We just need to find the one that suits us, the one that works for you. And if you're not getting that support, then you need to push forward and find, because they're out there. Absolutely 100% they're there. Just find the right one.
Find the right one.
Yeah.
Thank you so much for joining me today for this podcast.
It's been a pleasure.
Thank you for sharing your personal experience as well as your professional expertise. You're 36 years in the field, and I hope it's going to help a lot of listeners in terms of maybe just accessing information or learning little tidbits that you offered today. And hopefully it's going to encourage people to not feel alone and go out there and advocate for themselves,
Yeah, I think it's important to know, like when we talk about that I've been in the pharmacy world for such a long time, what I've witnessed is such a change in the stigma that was put with estrogen therapy way back when was such a dark cloud around it. But there's more to estrogen therapy now than there was way back when. There's so many different options. It's not like taking this one high-level estrogen tablet that's going to have all these different side effects. We're talking about topical estrogens, topical progesterones. So I think I just want people, that's what I've learned over the course of my years in the pharmaceutical world, is that estrogen therapy has come in leaps and bounds, and there's options. Seek your options, know your options. It's been a pleasure to speak with you. And I hope that your listeners can take a little bit from what I have to share with my journey through menopause, and hopefully it helps.
Thank you. Thank you for your time.